This is try number 2 because the first one didn't upload. But so this week we're kind of talking about chapter 2 of Lisa Cooper's book, Why Are Health Disparities Everyone's Problem? So the general focus on chapter 2 is the patient physician relationship, and I was super excited to read about this because of my experience in social work. Everything we do is very patient centered. Even like our code of ethics that we adhere to focuses a lot on like even the relationships of your patient. Those are important, those are valuable, and we need to respect them. So learning more about this is very interesting to me, and how it's kind of different depending on what profession you're in. I was also super excited to read about it after we learned a little bit more about the JJ way last week, and how many positive implications can come from that, from just kind of building a rapport with your clients and taking the time to listen and ask questions. So I was super excited, but I really enjoyed chapter 2. I'll kind of talk about like some of the highlights from it. One thing that I wanted to talk about was the importance of taking a patient's history in order to go ahead and provide unique care to every individual circumstance. In social work, we have like these things called biopsychosocials. So we sit down with the patient. It's usually like our first time meeting them, and we talk about like their background, their history, what is their family like, is something run in their family, how many times have they come to seek care, like what has that experience been like, any like personal things that they need or want us to know right up front. I think that that's super important and helpful. So that's just the first thing that came to mind when we talked about that. I also thought it was really important to discuss the barriers to an effective partnership, because that can impact so much, like the equal access to healthcare. One of the things I wrote about or wanted to talk about was racial bias and stereotypes. How in the book Lisa Cooper kind of talked about how, depending on their own internal biases, that can impact how they interpret the symptoms and behaviors that their patients are actually like presenting to them, and how they're going to move forward with care. On a similar note, like their different cultural or ethnic understandings kind of can impact how they view those symptoms, how the patient is relaying those symptoms, and how they're feeling in different situations. And then one thing that was really big for me was the patient versus the healthcare professional's expectations. So in my brain, I'm like, okay, there's such a huge difference in like education and experience level, and like even just being exposed to different things. So you could potentially have someone, a healthcare professional with years of experience under their belt, with someone who's, it could be their very first time even talking to a healthcare professional. I thought that that was very significant. Like, how do you find that level to have the same expectations, or like even see a common ground on that, when it is like, if it's my first time going, I might not even know what type of expectations to be looking for, and that can be a very scary situation when you're going up against someone, not up against, you want to work with them, but you're going into a situation with someone who does this every day, all day. It's their profession. And then kind of going off of that, a little bit, some of the other barriers that I noted were more like of the person. So different literacy rates can impact a lot, because if you're given a pamphlet with information and you might have difficulty reading, and that's not your first language, if there's like language barriers, then that's a whole other host of issues that you might be given the resources, so you technically have access, but not the same level of access. So I thought that that was important to include as well. Um, One of the quotes that really stuck out to me this week was on page 46 into 47. It was, the physician's perceptions of patients' education and physical activity preferences were also significant predictors of their recommendations. And this is independent of clinical factors, so severity of their symptoms, appropriateness, so actual like physical results and symptoms. So that's crazy. Payer, so that's like if they have private or public insurance, or if they have any insurance at all, and then actual like physician characteristics going into that situation. So to me, that's just so mind blowing, because a doctor could go into a situation, look at all of these factors, and still go ahead and like, yes, consciously or unconsciously kind of alter their recommendation based on the patient's education or like their physical activity. Like that's so crazy to me, because I would like to hope that no matter what situation you find yourself in, you should have access to care. But I understand if it's unbiased or something that's implicitly happening that they don't always think about it until it's too late. Um, so yeah, it really does depend on the doctor and the training, cultural competency training or implicit bias training or anything that they have received prior to that. So another thing I kind of wanted to talk about was all of the findings that Lisa Cooper goes on to talk about or mention in the book. So her different research studies that she has all of her mentees working on her with. Um, well, I found them a little bit disheartening. I know that they're realistic and I do think that they're important to talk about. So, for example, with one of the studies, it was mentioned that when a doctor dominates the conversation, and they fail to kind of provide and put first a patient centered environment, the patient can go on then to view the doctor as being less respectful and less trustworthy because they don't feel listened to. And then that in turn directly can impact their own care. For example, if you're in a situation where you feel like, oh, this doctor's not listening to me, they're not even letting me talk, what's the likelihood that you're going to come back and see them or you're going to adhere to whatever plan that they put in place for you? It's a lot less likely, especially when you have different things on your plate. If you're the sole provider for your household and you're dealing with all of these external situations, going to the doctor is not going to be your main priority, especially not if they don't respect you or you don't feel respected and cared for. I thought that that was really important to include as well. Kind of on another note, Lisa Cooper then goes on to discuss the methods to overcome implicit and explicit bias. One of the methods, I guess, that stuck out to me was the individualization. So essentially, in my brain, I kind of condensed it into you're just treating every patient like a unique human and understanding that every patient should be cared for because they are a unique human. And going off of that, on one hand, to me at least, it can feel kind of defeating that we have to come up with acronyms and methods and interventions in order to help healthcare professionals genuinely care about other people. But in the same breath, if that helps to create a higher likelihood that doctors are going to help work towards health equality, then I think these trainings should be advocated for and standardized across the board in order to help everyone in our communities. So that's kind of what I thought about for chapter 2. There was a whole lot in there, but I really enjoyed it. So thank you.